That's it.
Yeah.
They call me Dr. Worm. Good morning, how are you? I'm Dr. Worm. I'm interested in things. I'm not a real doctor, but I am a real worm. I am an actual worm. I live like a worm. I like to play the drums. I think I'm getting good, but I can handle criticism. I'll show you what I know, and you can tell me if you think I'm getting better on the drums. I'll leave the front unlocked, 'cause I can hear the doorbell. Tell me if you think I'm getting better on the drums. I'm not a real doctor, but they call me Dr.
Yahoo! It worked.
Woo! Welcome to the Happy Gut webinar. There are no real doctors among us as far as I'm aware, unless one of our guests. Oh, let's turn that off. But we do have some real worms to talk about. Worms that get us healthy and lead to hopefully ever afters. The potential to create what we want in life when we're well and we're in balance. So yeah, welcome tonight. Thank you for joining me. My name's Dan, and we've got Denise with us. So
Hi, everyone.
I'm going to have a little chat to begin with, and then I will introduce Denise formally, hand it over to her. She's going to present the webinar tonight, to go like really in depth to what we need to know about our gut, how we got to this place where collectively there's so much that's not going right with our gut and with our health, and present some options to what the path could be to healing and to restoration of that ecosystem that that we have, that is our gut biome. So she'll present her experience really from her clinical practice, as well as the research that she's seen over the last 5 years into Helminths therapy, and the exciting possibilities that exist in that field for health and healing. So, as I said, my name's Dan. I'm a nutritionist, I'm an intuitive healer, I'm a health coach. And it's really, I see it as my job to make healing easy for you, or to remind you of your natural innate ability to heal, to connect you with the medicines that you need to bring your body into balance and bring your mind into alignment, and to engage your intuition and your relationship with your health and with your body. So my business is called Sovereign Medicine, and I called it that because essentially, well, let's start from here. Medicine is corrupt. We're living in a time of deep corruption in the world in many aspects of life, and that's not to say that the corruption comes in that we are disconnected from being the sovereign one, being in a position of power where we know what the right course of action is for our body, for our health. So we outsource that responsibility, and we've been taught and conditioned in that way to give away our power to sources outside of ourselves. And now this doesn't mean that we can't collaborate with the wonderful people in medical industry, with healers, with shamans, with those with the knowledge of natural healing. But what I'm getting at is we need to take responsibility for what happens in our lives. So I chose that name because it's powerful. It's a little bit dangerous, a little bit controversial, maybe. But for me, that is, what my job in my work I see is to lead you into your truth, into your knowing, so that then you can take over. You can be reconnected with your intuition, with your natural ability to heal, and you can bring forth the medicine that's within you as well to share with your community, your family, share with the world. That might be a natural connection with plants or food, or it might be a song, it might be your voice, it might be dance. It's basically about your passion and what you love. So the world is needing your medicine. Firstly, you need your medicine, and then the next step is to share that medicine with the world, because that is how we're going to heal, and we're going to come together as sovereign beings to share, because we don't need to know everything. We need to know what's relevant for us and what is exciting to to jam on and to talk about, and to share with others. And in that way, that is my vision for the reclamation of medicine. I've had a few hospital encounters already in my life, and there's been times when I've been grateful that it has saved my life. But when I've been in the hospital, I thought, we could get some plants in here. We could get some beautiful music, beautiful sound healing going. We could have acupuncturists coming and working, crystals. We're so limited in the mainstream medical model, the industrial medical complex of limitation and sort of prescription and diagnosis, and just a certain path. And I see people going down and accepting going down that path, and it can ultimately lead to an early death. This sort of cascade of missing things, misunderstanding what is possible and how simple it can be to heal. And I suppose that is something that one must be passionate about, and really it's about quality of life. So it's about just taking that moment to stop and think about, hey, my life has kind of been on autopilot. This often happens when something goes wrong. It can be, sometimes it's cancer, when people really need to think, hey, am I gonna accept 2 years left, or am I gonna start to explore some other options? For me, that came when I was 20. I had this recurring cyst on my tailbone, and after 3 operations and knocking down the barrel of a 4th, I thought, you know what, this isn't working for me, and there's got to be a better way out there, and I'm going to find that way. So I refused that treatment, and life led me to the person I needed to meet at that time, a wonderful homeopath who had been doing the work for many years, and he assured me that that it didn't need to be hard, that we'd have success, and that my body knew how to heal. He was able to show me the medicine that would remind my body of what it needed to do, and then that got my sort of mind and my heart engaged in discovering and learning more, and learning how to not just to be free of this disease, but to begin to thrive. And so I guess we'll just segue into the part about the gut health, because I suppose for going through that ordeal and stuff before then, chronic sinus infections when I was a teenager, lots of antibiotics, and a few those hospital visits that I mentioned. One was food poisoning in India, and then later on that trip in Finland, I had appendicitis, but I still had my appendix because I knew what I needed to know, and had the faith and trust in in myself, really, and knowing that I didn't need to have that operation either. And when that happened, I thought, okay, it's not right to tell someone don't have an operation that you might need to have to save your life. The question is how can I share and sort of empower others with firstly, you need to know a little bit as well about the body and how it works, and then you need to know how to find the information that you need, and how to access your intuition with clarity, and back it up with a bit of sense. A lot of intuition is from drawing on things that don't make sense. But yeah, we want to bring it all together. So my experience, all those antibiotics that I had, hospital, and general anesthetics as well, just left my gut in a mess, really. And so somewhere in my 20s, I figured out if I didn't eat gluten, and also probably observe more of a paleo or grain-free diet for a time, that kind of helped to address a lot of the symptoms that I had. And then I'm just seeing Laura raised her hand. I'm wondering if that is something about that we need to know about the transmission. Laura, if you want to speak or write in the chat, otherwise I'll keep rolling. Yeah, basically just to sort of sum up what I was saying, I basically, and I had this discussion with a client earlier today, actually, and it's like you learn how to manage the symptoms. And he was saying, so I can't have gluten, I can't drink alcohol, I can't have coffee, I can't even have decaf coffee, I can't have chili. And then I said, oh, it sounds like you can't have fun. And he mentioned if you can't have dairy. And you get to a point where you can maintain. And I found I could maintain my health, feel pretty clear, but just do one wrong thing, or for fun or by accident, and then you're kind of stuffed for the next week trying to clean that up. So in that process, I've discovered some things that really helps, and cleansing techniques, and a lot of practices that can help. But when I brought in the Helminths not long ago, that just brought in this whole sort of sense of safety, because suddenly I was able to eat gluten with side of symptoms being 1 out of 10 rather than 11 out of 10. So that means still, and Denise mentioned in our last webinar, it doesn't mean that you can just be on the couch eating sugar all the time and not looking after yourself. But it does give more freedom, more enjoyment, and also really, like, when you have an instinct to eat something and then your body disagrees with you, then you're at war with yourself, and how can you trust your body? How can you know what the right course of action is? And then you get lost sort of Googling and looking at answers that other people have found, ways of things to avoid, things to add in, and then you're disconnected from that. So what I've found from this treatment is just such a powerful shift, and I am really excited to be supporting others with that as well, and to see what's possible when you get your gut right, and then where we can go from there. So at the end of the session, after Denise has made her presentation, and there'll be time for you to ask questions of Denise or from me, and then you'll get a survey at the end of the call, which will be between 8 and 8:30. That's right, isn't it? Yeah. About whether you'd like to follow up and explore the next steps. That's providing that the technology goes the way that I think it's going to go. So if you don't get a survey and you do want to connect and explore it further, just do reach out. So I'll hand it over to Denise. Denise is a senior naturopath in Brisbane. She's been practicing for about 13 years. She started her career in 1970 as a registered nurse. She shares some fascinating insights. Last week in our practitioner webinar about her journey and the collective journey that has the understanding that has emerged in the last few decades, because when she started, they didn't know what a gut biome was. They didn't know that we had these trillions of organisms in our gut that actually, well, she's going to get into all of that, and I'm sure you've heard a little bit about it before. So coming from that sort of place of innocence or naivety, like all of us in the medical field, and finding our way back to something that I guess intuitively, the grandmas in cultures have known about, fermenting foods and about their ways to look after ourselves, and to heal, connect with nature, and to heal. And she's going to explain kind of how we've sort of what's going wrong and also what's going right. But Denise pretty quickly became interested in gut health, mental health as well. A lot of great success stories around autism and ADHD with kids. I'm sure she's going to share about that. And Denise, feel free to take over, share a little bit more, and then we'll get your slideshow happening and crack into it.
Okay, thank you. Thanks, Daniel. That was great. Thank you, everyone, and thank you for joining us tonight. I'm going to do a talk tonight, as Daniel said. I'm going to talk about the gut first. What's happened in the last 100 years? How come we're getting so many autoimmune diseases? What's happening in the world? and I'll be talking about that, and then I will go into helminth therapy. As Daniel said, I've been practicing for 13 odd years. I've actually been a gut guru since 2007 because I believe, just like Hippocrates said in 420 BC, that all diseases begin in the gut. And he was so right then. And we know now that everything that we're doing externally affects our internal microbiome. So let's start, because we've got a few slides to go through. So first of all, I'm going to talk about the gut, as I said, and the importance of gut health. And this is Hippocrates, the father of medicine. He said, as I said, 420 BC, all diseases begin in the gut. That means that all health starts in the gut too. So what is the human microbiome? Well, this consists of millions and trillions of microbes that live on our body and within us. So we are talking about every microbiome, that all these germs, these bacteria that live on our mouth, blood, tissues, gut, vagina, and see these lovely dermatoids that you see down the bottom. These are little mites that live on our eyelashes. If you actually look under the microscope, that's what we have on our eyelashes. We have them up our nose. We have them in our vagina. So we're just made up of trillions of microbes. And
Denise, are you running your slideshow yet?
Yeah.
Oh, I'm not seeing it.
Oh, why not?
Did you share your screen?
Maybe let's go back, will I?
Yeah, so if you go back to the Zoom and just go down to the
hang on.
that bottom panel.
Oh, hang on, I'll end this one. Okay, so far out. Sorry guys. We had this all organised today, and now I've lost it again. Why won't it open up? Oh,
are you on it? Can you see
no,
the screen?
No, can't see a bloody thing anymore. Oh, yes, I can.
All right.
Okay, let's go back.
So if you just go down the bottom.
Yeah, I have done that.
Yeah.
I'm pressing shares. Can you see
that?
That
looks promising.
Yeah.
So now you just start the slideshow.
Yeah, but are you seeing the whole thing or not? I've got to go back.
You need to start it,
yeah,
but I can see, yeah.
Okay.
Perfect.
Sorry, guys. So we talked about Hippocrates.
Yeah.
This is about our human microbiome. See those horrible little things down the bottom here? They're the little dermatoids that live on our eyelashes, up our nose, in our vagina. They're everywhere. And that's what they look like. So they're microscopic. So you can imagine how many trillions of microbes we should have on us and in us. And they can be anything. We can have bacteria, fungal, protozoas, and any viruses as well. So what is the gut? The gut is known also as the GI tract, the gut, the alimentary canal. It's an organ system. And don't forget, this is the longest system in our body. It starts in our mouth, includes our saliva glands, goes down to our esophagus. It includes our liver, gallbladder, pancreas, stomach, and your small intestine, which is the longest part of your body. It's about 7 meters long, and then it goes into the large intestine. So it is the longest organ in your body. And what do we need? We need to break our food down. We need to digest our nutrients from our food, and we have to expel the waste. So it's a really hard-working job, and particularly it involves the liver. And people that have a fatty liver, it's because their digestive system is not working correctly. So we looked at the outside macrobiome, but let's talk about the microbiome. And this is what the gut is. It's the microbiome. It is also known as the gut flora or gut microbiota. Has everybody heard of those words to know what the gut microbiome is? And we've got to understand that from our esophagus to our anus, we have 2 kilos of bacteria. And in that, there are trillions of microorganisms. As Daniel said in the introduction, that we don't even know to the full extent. In 1970, the gut microbiome wasn't even heard about. And it was only in the 1990s that scientists actually said, oh my God, this gut has a reason. It's there, it's our immune system. And over the last 20 years, there is so much scientific evidence proving that we've actually destroyed the gut microbiome over the last 100 years for various factors. And once we've destroyed the microbiome, that's when we start seeing a lot of chronic illnesses, including, you know, like autism, food allergies, all autoimmune diseases. There was no such thing like celiac is a disease of the 20th century. There was very few and far between prior to this. So we know that we've got trillions of microorganisms, and there's millions, there's like, we don't even know, but at the current there could be 300,000 to 500,000 species of bacteria in our digestive tract. So the gut microbiome, we've heard good and bad bacteria. We know that we need both, believe it or not. We need bad bacteria, but only in the right proportion, because bad bacteria is actually what makes our B vitamins and also vitamin K. But we want them balanced. We want mostly good bacteria, and the good bacteria, most of our good bacteria is known as bifidobacterium or lactobacillus. So we all have a different microbiome, and our microbiome changes every day depending on diet. So if you, one day you have a sugar binge and a lot of wine to drink, your microbiome will change, and opportunistic microbes such as, you know, like candida and everybody's heard of thrush, they will take over in different circumstances. So it changes, it depends on what you eat, where you live, the water you drink, and the medicines you take, just to name a few. So we know that 80% of our immune system is in our gut. But we've got to understand that we are an ecosystem. And when we look at the outside world, everything should be balanced and in proportion. But what's happened? I'd just like to give you one example. This is something that happened in Yellowstone National Park. It happened in the 1920s when they decided that they were going to get rid of the grey wolf because they thought the grey wolf was bad and was killing too many elks and it wasn't right. So what happened over the next 70 years was that they got rid of the grey wolves, the elk took over the whole of the place, and it started eating all the trees, wrecking trees, just pulling them down. I don't know if anybody's seen an elk eat, but they just pull down the whole tree, break the branches. And what happened was that the beavers had no trees to build dams. And so this has affected everything. It affected all your fish, all your birds, amphibians. And it wasn't until 70 years later, in the 1990s, that they decided, wow, what's happened? There was one beaver dam left. So they reintroduced the grey wolf into the national park, and currently there are 500 beavers, and that's 6 to 7 beavers per colony. So what a great story. It just is an example of you cannot change things that are meant by nature. And what have we changed as humans? My golly. Look what's happened in the last 100 years. We started using toilets. And toilets are one of the worst things in the world because we actually have to strain when we do a poop because we're going against gravity. So if you're sitting on a toilet, it's really hard for us to do a poo, really. So what we need to do, we need to start squatting to bring the rectum at the right angle. And nowadays, everybody started realising this, and you can buy actually online a thing called Squatty Potty, and it sits around your toilet and you put your feet on there and it allows your rectum to be in the right, like you know, state to do a poo. So that's one thing that we've started doing. We started wearing shoes all the time, and this is, you can see it over and over again. Kids down at the park, they've got shoes on. Nobody plays in the dirt anymore. Nobody rubs in mud anymore. Nobody, you know, eats sand anymore, eat dirt. We've become a sterile community. We started eating highly processed foods, and I'm guilty of this. Like my kids were brought up in, you know, they were all born in the 70s and 80s, And I was nursing at that stage, and it was great. We were getting all this processed food from the shop that would just fill their lunch boxes. So you'd put a muesli bag, you bar, chips, you know, you name it. It was going into the lunchbox, but it was highly toxic. But being a nurse, had no idea about the other side of the world. Then we started drinking water, like just water. And really and truly, they did a study, and in plastic bottles of water, they actually found 24,500 chemicals. And why is this so? Well, what happens is they put boiling water into the plastic bottles, and it leaches the chemicals from the plastic into the water. And so this is quite a scary figure, and you can actually find it online. We stopped breastfeeding, and I'm telling you, at one stage in the 90s, they were encouraging women. And even today, I heard a story, one of my clients had twins and they were prems, and they're saying they're not putting on weight. You know, you've got to put them on, you know, formula. What are we doing? Why are we encouraging? Why don't we do the other way and look at how we can increase milk in that mother that's breastfeeding? We started using antibiotics, and as you know, way back, it's actually improved, I'd say, in the last 10 years. Doctors have become a little bit stricter. They won't willy-nilly antibiotics. Some will, but a lot actually tried more natural therapies. But back in the 2000, every time you went to a GP, you just got prescribed an antibiotic, and that was it. What is really scary? C-sections. We're seeing more and more, and it's convenience of the doctor that doesn't want to have a baby delivered on the weekend, so he says, oh, you need a C-section, you know, Friday before I go on holidays or whatever. So the list goes on and on, but all these changes have happened in the last 30 odd years.
Denise, it would be great if we could see your face.
Okay, okay. Sorry.
Can you do that and still see your screen?
Yeah. Yes, I can. So what's happening? We started using pesticides, fertilizers, plastics, cosmetics, fragrances, heavy metals, brominated flame retardants, methylmercury, and even this mercury is in our vaccines now, but in a different form. We've got parabens and PBA and other industrial chemicals. But this whole story is, this is a scary factor, and this is the latest research, that 158 million chemicals are listed on the chemical register. This is only what's listed. You've got to understand how many other companies, and particularly start looking at China, that haven't listed chemicals in the registry. So this is a mind-blowing figure. So let's go back to the gut microbiome. We know that your gut microbiome is developed in utero from your mother and father, and it's at birth. They've actually, you hope that you have a really healthy gut before you deliver, and that's what I tell all my mums that are coming for advice. We've got to get your gut perfect so your baby, when it's born vaginally, that you can actually have a good range of good bacteria. And so we start working on the gut straight away. You really need 12 months before you want to fall pregnant to heal the gut. And Caesars, they did a study, this is pretty mind-blowing, that they tested the babies, and the gut flora of the babies that was cesarean section definitely had the microbes from the mother's skin, but a lot of the microbes was actually from the nurse's hands. So that's a pretty scary thought, isn't it? And breastfed, you can get everything from your mum. As long as your mum's got a good microbiome, the baby will have one. We're finding now that people that don't have good microbiomes, their babies might be unsettled, they might be colicky, and it's all due to their gut microbiome. It's just like us having reflux. Babies can get it too. And bottle-fed babies, naturally, they don't have the same immune as what breastfed babies do. But stress, oh my God, stress is one of the biggest killers of our century. And we're all living in stressful situations, even now with COVID. I mean, how scary is what we're living in at the moment? Like, so many people are stressed, and so many people have been losing jobs. How are they going to support their family? How are they going to pay their mortgage? Stress is a killer. And everybody knows with stress that cortisol rises, and that's just a natural instinct of your body. And if cortisol goes up, it affects what we call our vagus nerve, which is the longest cranial nerve, which goes from our brain to our gut. And then we actually start seeing changes in our gut microbiome. And people actually present with me and saying, you know, they're stressed and how stressed they are. And they've even got either constipation because the vagus nerve can slow down, or they've got urgency, frequency, and wanting to go to the toilet all the time. And that's because their vagus nerve is stimulated to a degree that they can't even get outside their house because they're worried about where the next toilet is. And I've had a lot of clients like this, a lot. Our environment has changed, that's affecting our gut microbiome. Medications, oral contraceptive pill, antibiotics, cortisone, heart medications, protein pump inhibitors are all wrecking our gut microbiome. Lifestyle. We live a crazy life. Everybody's on the go, go, go all the time, and that is affecting our gut microbiome. So diet plays a huge part. You know, we start looking at people, like I had a lady today and she said, I'm just craving sugar all the time. Naturally, she's craving sugar because she's got an imbalance of good and bad bacteria. And as I said, opportunistic candida will take over and they want sugar. So they say, bring down the sugar. And that's exactly what happens. So the gut microbiome, as I said, we need the bad bacteria because they make vitamin K and our B vitamins. But also we need a healthy gut microbiome because they break down and digest the nutrients that we're eating from our food. And as I said, the gut-brain axis is that particular one that affects the gastrointestinal tract with that vagus nerve. So
when you're overrun by candida, then you're not really in the one running the show.
Sorry?
When you're overrun by candida, you're getting these messages from these little critters
and you know,
telling you how to behave, really.
Yeah, they're saying bring down the sugar.
They hijack the nervous system, yeah.
And you know what else they do, which is really, they cause the brain fog. And how many people that you see, and they've got all these gastrointestinal symptoms, and they come to you and they go, oh my God, I'm so brain fogged. I can't even think. They can't even think what a word is to an everyday object half the time, because the gut brain is so connected that when we've got an overgrowth of candida, it can affect our brain.
Yeah.
You don't have to have, this is what a lot of people don't realise, with candida, you don't have to have the symptoms of a thrush. You don't have to have a vaginal discharge, or you don't have to have an itchiness or anything. It becomes systemic. And when it becomes systemic, it's harder to fix because it's been usually a state of a long time that they've been sick for or had an imbalance. So we now know the gut-brain connection, and this is really interesting. All the scientific evidence knows that if our gut microbiome is out, it's going to affect our brain. And don't forget, this is so important to understand, that 90% of our serotonin is made in the gut. So serotonin, happy hormone, mood, sleep, gastrointestinal activity. If you don't have serotonin being made in your gut, guess what it does? It slows your gut down. Really bad constipation. So this is when we actually start seeing mood, constipation, hand in hand. Dopamine, 50% is made in our gut. So dopamine is our reward pathway. This is for our mood and our motivation. But how many clients do I see in my clinic that say to me, oh, Denise, when I get to bed, I can't unwind. My brain is going 1,000 miles per hour, and I might not get to sleep till 2, 3 o'clock in the morning because I can't switch off. The alarm goes off at 6 and I'm buggered and I've got to get up again. And this is because the gut converts glutamate from our food, which is excitatory, into GABA, which is inhibitory, which puts us to sleep, which slows it down. And if you're not converting glutamate to GABA, you are going to get anxious, moody, PMS increases, pain increases. And we also see a lot of this in ADHD. And I do a lot of work with autism, ADHD and Asperger's. And I'm telling you, I see a lot of this excitatory state that these kids are in. And the mother's beside herself because you might be trying to put a 4-year-old to bed and they're still playing at 10 o'clock. So it's all about the gut, the brain. So we know that most germs enter through your mouth or nose. It's 80% of our immune system in the gut. And the gut, this is what they should be doing. They should be killing pathogens. But if we don't have the right gut microbiome, those pathogens will take over. And this is when we start seeing people present, you know, like with parasites such as blastocysts and giant amoeba. They only take over once again when you've got an imbalance of good and bad bacteria. We also need the gut to ferment fibre. Now, fibre is the most important thing that we should be eating in our diet. You know, as far as, you know, what the Australian government says to us that we should have, you know, 30 grams of fibre per day. I've just listened to a podcast the other day and now they're saying we should be having 100 grams of fibre. And why do we need fibre? Because fibre, whether it's soluble or insoluble, and I've got a list of what soluble and insoluble fibre is, we need fibres to make our short-chain fatty acids. Now, this is the most important thing. People that take probiotics, you may also not take them unless you're taking a good prebiotic with it. If you're not getting enough soluble and insoluble fibre, and that's 100 grams a day, which is a lot of fibre, you will not make your short-chain fatty acids. And as you can see on my screen, you need propionate, you need acetate, you need butyrate. They're your short-chain fatty acids. And they are, particularly butyrate, makes what we call bifidobacterium, which is our most bacteria they're the good bacteria that we need. We need the butyrate. And all of these, we need these prebiotic states to increase energy, to increase glucose-stimulated insulin secretion. We need good short-chain fatty acids. And I can actually say in my clinic, I have probably about 15 different fibres on my shelf because I have to give the right fibre for the right condition. And I will never prescribe a probiotic without a prebiotic. And that's just what I've learned over a lot of years. So we have to...
You used some technical terms there, Denise,
okay.
but basically what you're saying is you need that fibre, which we know what that is,
yeah,
to increase the production of short-chain fatty acids.
yeah.
And basically what they do without really having to know what they are or how they work, but we need them for
To make up
regulating
probiotics.
our appetite, energy production. Anything else you'd like to?
Well, with that, what our short chain fatty acids do, they not only do all of that, what's on the slide, but they also are needed to make our probiotics grow. If you're having a multi-strain probiotic with a lot of different strains, such as Lactobacillus, Bifidobacterium, whatever you're doing, if you don't have enough short-chain fatty acids, which you need from fibre, to make propionate, acetate and butyrate, they're the short-chain fatty acids. If you don't have enough fibre to make these, you will not be able to retain your probiotics in your system. You need a prebiotic state to make your probiotics grow. And so if you're just taking a probiotic, as most people do, it's not going to help because unless you've got a really good fibre intake, and that's soluble and insoluble fibre. So yeah, that's what you need. You need to have a good short chain fatty acids to make everything work.
Yeah, awesome. And thank you for making that distinction.
That's okay. So we know the balance of our gut can be distributed by several factors, physical and mental disorders. We know all that. So what can damage our gut flora? We talk about this. I've told you about pharmaceuticals such as antibiotics, oral contraceptive, heart medication, steroids, antacids. And mind you, every doctor, if somebody goes to a doctor because they've got indigestion or reflux, they put them on protein pump inhibitors. And it is such a bad thing because protein pump inhibitors inhibit our hydrochloric acid, which we need to break down foods. And most of the time, it's not that they have an overproduction. The symptoms are the same for an underproduction of hydrochloric acid.
Yes.
So this is where, you know, like we should be looking more and more and asking about their medications. Poor diet can affect it. Bottle feeding, pollution, alcohol, smoking, dental work, particularly with amalgams, stress, we've talked about that, infections, old age, radiation from chemotherapy, you know, all of these chemicals, pesticides, fatigue, sleep deprivation, which are all going hand in hand with stress.
So with that hydrochloric acid one, I love clarifying that one because it might seem obvious that if you are having acid reflux, that you have too much stomach acid, but what it can actually be is that you don't have an adequate amount of that hydrochloric acid to break down your food that sort of first or second. Yeah.
So people actually say, how come you get a reflux if you've got an underproduction? Well, don't forget, your hydrochloric acid is produced in your gut to break down proteins.
Yep.
Okay, so if you're eating red meat, first of all, your salivary glands in your mouth start producing enzymes to break down protein. Most of our protein is broken down in the stomach, and we need hydrochloric acid to break that down. So if you're not producing enough hydrochloric acid to break that protein down, it sits in your stomach and you start getting symptoms like reflux, burping, because you've got no hydrochloric acid, so your protein isn't broken down correctly. So, and also it gets more complicated because if you're not producing enough hydrochloric acid, you then don't produce enough pancreatic enzymes.
Mm-hmm.
And pancreatic enzymes, as you know, released into the small intestine after the food comes from the stomach into the small intestine. And you have different enzymes for protein, fats, and carbohydrates. And if you don't have hydrochloric acid, it's very likely that you're not producing enough enzymes as well to break down those foods. So this is when we start seeing symptoms. And we know that a lot of the symptoms, which I'll talk about in a minute. So yes, we have good and bad bacteria, but we want them balanced. And as I said to you and keep on saying to you, if there's an imbalance and if there's more baddies than goodies, then the opportunistics such as yeast, harmful bacteria, parasites and fungi will start taking over. So we have to, and I honestly, I love the gut. I work with it every day. That's what my passion is about, the gut. And people see me in my clinic when they come to me, they might have had 10, 12 years of putting up with chronic symptoms. I've got a lady at the moment, 21 years of being on PPIs, protein pump inhibitors, for reflux. And she's actually got nothing. She's got no. I've just tested her for SIBO, which is small intestinal bacterial overgrowth, and out of all my years of working with a gut, which is like 13 plus years, I have never seen such a high reading of methane gas, ever. And she's had 21 years before she saw a practitioner, and she got recommended to me, but it's going to take a long time to heal. When you've got somebody so chronically ill with gastrointestinal symptoms, it can take 2 years to recover. It's not an overnight event.
Yeah.
So the signs and symptoms of dysbiosis. Dysbiosis is a word just for an imbalance of good and bad bacteria. So these are some of the symptoms which you see in your clinic: abdominal pain and cramping, bloating, bad breath, white-coated tongue, frequent burping with every meal, reflux, excessive flatulence, and if it's offensive, it's usually something to do with the sulfur pathway, constipation, diarrhea, skin conditions. Start looking at acne. And what about, how many people have keratosis pilaris? Does everybody know what that is? It's those little bumps on the back of your arms or on the top of your legs. And that means you're not absorbing essential fatty acids. Then there's food allergies. Oh my God. And intolerances. I'm seeing more and more food intolerances lately because people, when they've got an imbalance of good and bad bacteria, naturally they become more and more intolerant to food. And, you know, some people that I see in my clinic, they might be only eating 5 foods by the time they get to me because they're reacting to everything they're eating.
Yeah.
And that's only because of dysbiosis, an imbalance. They've also got nutrient deficiencies. They become anemic. Restless legs is when you get into bed at night and you're just about to go to sleep, or you're asleep and then you get really bad cramps in your legs and you have to jump out of bed. That's really magnesium deficiency. Hair loss, a really big thing. And I'm seeing more and more people with hair loss at the moment, particularly because of the stressful situation that everybody's living under. It also affects your anxiety, depression. We talk about the gut brain, mood, hormonal imbalances, obesity. We know now that a particular strain of bifidobacterium will actually increase weight. And here we go. People get more and more sick and they tell you, oh my God, I've had 3 infections. I can't get over one and I've got another one. And this is the stories that I'm getting in my clinic. So we talk about a leaky gut. This is a really good diagram. This is our normal intestinal mucosa cells on the left-hand side, the 3. They normally stick together and they have what we call tight junctions. However, once we start getting, you know, like dietary programs, low hydrochloric acid and enzymes, which I've talked about, we have a lot of medications, infections, blood sugar issues, and antibodies, we start getting inflammation of our cells in our gut. And this is what that N1 is, a leaky gut and inflamed. So they have little hairs on our little cells in our gut, and these become red, swollen, they die. The cells are no longer a normal tight junction, and they leak undigested food into your bloodstream. And once they get into our bloodstream, they can affect our brain. They cause inflammation in our body. We start seeing more and more autoimmune disease and malabsorption of food and nutrient deficiencies. So these are some of the conditions associated with dysbiosis or an imbalance of bad bacteria is periodontal disease, inflammatory bowel disease, that's Crohn's and ulcerative colitis, allergies, SIBO, which I've talked about, which is small intestinal bacterial overgrowth, and this is when good bacteria from the large intestine migrate into the small intestine, causing a lot of symptoms. We're seeing more and more autoimmunity, so much more, like thyroid conditions, rheumatoid arthritis, these are just to name a couple. Chronic fatigue syndrome, obesity, cancer, diabetes, bacterial vaginosis, candida, endometriosis, and general anxiety disorder.
So dysbiosis, put simply, is the imbalance in the gut flora.
Yeah. So it's good and bad. There's an overgrowth of the bad bacteria compared to the good bacteria.
Yeah.
This is according to the Australian Bureau of Statistics. This is really scary figures. The National Health Survey showed that there was, in 2017, that, how do I get me away from here so I can read the slide? There was 4.8 million Australian with some sort of mental or behaviour condition. And we're saying there's 4 million people in Australia avoiding a food type because of a food intolerance. This is scary facts. And I tell you, I see in my clinic every day, people have to avoid food because they say they can't tolerate it because it causes diarrhea, it causes constipation. We shouldn't be like this. We should be able to eat everything, but we've destroyed our gut microbiome. 1 in 9 Australians have asthma, that's 2.7 million population, and 1 in 10 children have ADHD. And this is only, don't forget, a fairly new diagnosis, I'm saying the last 20 years. So people have been living with ADHD forever and never been diagnosed. And I've now seen clients in their 50s, 40s that have been living and struggling with their life because they can't think properly, they can't think straight, you know, and they think, oh, they're dumb, but they're not dumb. They actually have a condition. So start talking about autism spectrum disease, allergies, autoimmune and chronic inflammation is on the increase. And in 2018, there were 205,200 Australians with autism. That's a 25.1 increase from 2015. Now that's scary, scary figures. Childhood cancers, diabetes, obesity and depression have each doubled over the last 2 decades. And IBD, which is Crohn's or ulcerative colitis, 1 in 250 people nationally in Australia, that's 75,000 Australians have a condition with IBD. This is so scary, and I deal a lot with IBD, and guess what it comes down to with most cases? Stress. It's all comes from stress, and particularly Crohn's disease. We know that Crohn's and stress are hand in hand, and once you get a good case history, you can actually prove that. Autoimmune diseases affect 5% of Australians and are more common than cancer or heart disease. But nobody really thinks about autoimmunity as being, you know, like a figure like cancer or heart disease. I think that's 10 times worse. But autoimmune diseases, you know, when we think about it, they might start off as a celiac, and if you don't treat that celiac properly, they'll end up with rheumatoid arthritis, thyroid conditions, surgery, you know, it goes on and on. So a lot of people have more than one autoimmune disease. So to sum things up, bacteria are the cause of diseases in the 1800s. However, we've become a sterile nation, well, a sterile country. We started using antibiotics. We started using disinfectants in toilets, treating our water with all this crap, and we actually start destroying our gut microbiome. And don't forget, as you said earlier on when you introduced me, that we didn't even actually know about the gut microbiome until the 1990s. So this is really an important fact. But we learned from past cultures that all these people that used to ferment their foods way back, they didn't have the conditions like us. Yes, their lifespan was shorter because of bacteria and they couldn't kill it, but they would have had a healthy gut microbiome. So it's all about the hygiene hypothesis, and that's a big thing. I don't know if anybody's read about the hygiene hypothesis, but it's actually telling you what's happened to our environment. We've become very, very sterile. And I told her the story because, does anybody know Nicole Bishma? She's a building biologist and she's got her own university in Melbourne, and you can actually do a 2-year course about what's affecting us and how you can go and change people's homes, particularly.
Oh, yeah.
Yeah, she's amazing. And she told this one story that there's 2 things I'd like to talk to you about. One thing is that when you actually go out and go to the parks or go to golf or anything like that, come in, leave your shoes at the front door, because what you're doing, you are walking into your house, the glycophosphates that are actually sprayed on every single park, every golf course, everywhere. So leave your shoes at the front. And the second thing she taught me was that most people with babies, they actually wash their floors with bleach, do their bathrooms with bleach, and then your child will go into that bathroom or they'll crawl on the floor, and then the bleach will be absorbing into their skin, and they put their hands and then suck their hands.
What was her name? I'll just type it in.
Bishma. It's Nicole.
Yep.
Bijlsma.
I'll type that into the chat box because I thought that
she's brilliant.
There's some good podcasts around.
She's got great podcasts, so I would advise you. I've actually done her mold course, which was mind-blowing. I can actually tell you, because I see a lot of mold, and Sydney and Melbourne are the same, you know, because of the high humidities, mold just grows, and you should see what it's doing to so many people, like even fibromyalgia and chronic fatigue.
Yeah.
So, as I said, the lack of exposure to pathogens, we have become a dysregulated immune system, and this is what's causing autoimmune disease. So this leaves our system very vulnerable. And Dr. William Parker, who is a researcher in America, on helminth therapy or helminthic therapy. He says it's like leaving your teenager home alone with nothing to do. He or she is like to do something stupid. And this is what's happening with our bacteriovirus. It's attacking our immune system. And he's a head researcher, as I said, in America on helminthic therapy. So how can we repair a dysbiosis? Reduce stress and fatigue, number one. Like, you've got to bring that cortisol level down, or if you've had cortisol high for so many years, you've got to repair your adrenal glands. We need exercise, and even if it's a walk outside, up and down the, you know, garden or anywhere. If my clients have been really sick for a long time, I say to them every week, make it like, first of all, week 1, you might walk to the end of your driveway. Week 2, do 2 houses and back. So you can do it, and do it simply. You've got to improve sleep. If your brain isn't turning off because you're not, you know, making GABA, you need to improve that sleep. Diet, we need to change our diet, and these are some of the foods that I love. Bone broth is my number 1 go-to. I actually sell quite a few different varieties in my clinic, and depending on the client, what they have, I've even had vegetarian bone broth, but we need that because that's full of collagen. Collagen is all our amino acids that we need to repair our gut microbiome. And it also has calcium, phosphorus, magnesium, manganese, everything in it. So we need bone broth. Fermented foods, once again, fantastic. I love my ferments, and they are natural probiotics. So we need to increase collagen, and I've got so many beautiful collagens now, and there's one that I really love, and I do get an organic collagen from the bones from cows, but you've got to understand that collagen has all your amino acids in it. So that's what you need to repair your gut.
Those are the building blocks.
Sorry?
Yeah, exactly. Yep.
So we need pre and probiotics every day, and we need to include helminthic therapy. Not for everyone, but I love it, and it works so well with chronically ill patients.
Yeah.
Consider specialised testing. I do a lot of testing in my clinic. I do GI mapping, which is looking at the gut and seeing what imbalances you have. I do food intolerance test, and I love the OAT test. OAT is organic acid urine test. Brilliant. It tells me what's happening in your whole gut. So how can we repair it? We need a rich, high fibre. I can't say this enough. You need 100 grams of fibre every day, and you need bone broth. You should be limiting your sugar, processed food, gluten, and genetically modified food. You know, like, I'm sorry, I've got my dog. She's wanting to come up and listen. she's nagging me. And we've actually got to start looking at GMO-free foods, because even our wheat, you know, it used to be 6 foot high and flow in the wind, and now it's like 2 foot high and 80% glide, and compared to 10% in the 1950s. So that's pretty scary. That's why we can't eat it. We're not designed to take that much, you know, protein gliding in our bodies. And conventional meat, we should be actually going grass-fed meat, because all those grains that are given to the cattle and pork and whatever you're eating is full of toxins. And try and avoid as many antibiotics, acid blockers, anti-inflammatories as we can. Eliminate toxins, particularly tap water, chemicals, pesticides. Start using, you know, there's so many fantastic cloths for cleaning now. We don't need the chemicals to clean. You know, just using a good cleaning vinegar. That's all we need, and water. Avoid smoking and alcohol. So when I say this, I'm talking about, it's not a one-stop shop. You've got to do a lot of things. You've got to change your diet, exercise, nutrient, mineral supplements, lifestyle, and sleep. So what is helminthic therapy? It's a worm, and it should be in all native animals. It's not a pathogenic like Salmonella. That's a pathogenic, versus Acidophilus, which is a good bacteria. So there are good and bad helminths. So helmintic therapy refers to worms that are in people's intestine. It's not a parasite, so we don't get any implications. Like good and bad gut flora, we have good and bad worms. Helminths used to be part of our healthy gut flora. Way back in the 1950s, every single grain had what we call grain beetles on them. And they used to hatch larvae onto the grains, and when they harvested the grain, which was minimal harvesting, we used to eat them in our diet. And I can remember as a kid growing up in the 1950s that every time we had oats or we had flour, we actually had cobwebs in there, and that was the larvae from the beetles. But we ate it because our parents used to say, oh, that's good protein, you know, you've got to eat that. We didn't have food intolerances. We didn't have peanut allergies in our era. I didn't even know of a peanut allergy with any of my friends or any of my school friends. So after the last 100 years, helminths have disappeared from our Western diet because of all the things that we've been using. We've been using chemicals, we've been using fertilizers. It's just destroyed everything that we have. And plus now, genetically modified plants, they keep on modifying them more and more because the pesticides that they're using have to get stronger to kill off the germs. So I'm not talking about just, you know, the HDC beetles, which I use, but I'm talking about how many other beetles or insects have been destroyed from our Western society that we actually need in our lifestyle. And you know, we're talking about bees now. We're so worried about what's happening to the bee population, and everything that we're using is poisoning the bees. So helmintic therapy is the introduction of these worms back into your diet, and they're really beneficial for people with low immune tolerances. So as I said, peanut allergies never existed until 1980. So why? Dr. William Parker, he's a gentleman, as I told you about. He does all the research on helmintic therapy, and he's a guru, and he's actually doing one now, introducing helmintic therapy, HDC larvae, into people with Parkinson's. So helminths are our wonderful old friends. And in our society, we have 4 different kinds of helminths that are taken on a regular basis throughout the world. First of all, we have the porcine whipworm, which is from pig feces, and you can actually understand that people that live in a commune with lots of pigs around, such as Samoans and other countries, they never have anything wrong with their gut. They've got a really good immune system because they're walking bare feet, and these worms, the larvae from these worms are actually go into their system through, you know, their skin. But you can also take them orally. There you just take the eggs, the larvae, and you have to ingest them every 14 days. They never reproduce. After 14 days, your immune system doesn't recognise them, so it says, you know, get out of here. So it's passed in your feces. There's no eggs, there's nothing. They really work amazing. They are probably one of the best. They help with autoimmune diseases, particularly lupus, ulcerative colitis, Crohn's. But the bad news, you have to have 2,500 ova, which is the larvae, every 2 weeks, and at a cost of €300 a bottle. That's $480 Australian. So over the year, it'll cost you $12,500 per year to take these little babies. They are expensive, but they work really well. And a lot of people overseas that have easy access to these little babies take them with the HDCs, which I do. So they work well, but it's a very expensive exercise. The human hookworm, this is the second most commercially available helminths. It does have really weird side effects. What you have to do, you get the eggs and you put them on the outside of your arm. You wrap your arm in a bandage, and over the next few hours, you'll start getting a really bad reaction. You'll start getting itchy, and this is because the larvae bury through into your skin, and they go up through your arteries, and they go into your alveoli of your lungs, where you cough them out of your lungs, where they go down through into your esophagus. And this cough is known as the worm flu. And your whole body, apparently you go like you're on steroids. They say it's the weirdest effect. You're on a high for about 2 to 3 days. They said it's a great reaction, but your arm is red, itchy, sore. Anyway, so it's very hard. A lot of Americans make their own. There's a site you can go on to how to produce hookworms, and you might need 2 or 3 doses, but they do last in your system for 2 years. However, in Australia, we can only import them from other countries like Thailand. So I don't know if I'd trust the hookworms from Thailand. So I don't know anyone in Australia that's doing, but in America, a lot of people are doing.
Yeah, that sounds really intense, that process with the hookworms. But fortunately, what you've been working on is a lot more polite, a lot more pleasant in the application. Simply a little vial. I think you got a picture later on, but it's just something that you drink and get on with your life.
I know that one's like really severe, but interesting what they're doing in Townsville University at James Cook Uni. There's a doctor up there that's actually working with hookworms for celiac, and he's actually getting really positive results for celiacs where they've been, like infested with hookworms, and people that are chronic celiacs, they only did 12 people in the first trial, but they actually were able to eat past it without any ill effects after being infested with the hookworms. So now they're doing a huge trial, and he's been given a big grant to continue with this, because could you imagine that if hookworms restore your gut microbiome and that it fixes your gluten or celiac intolerance, like, wow, what a result.
What's going to happen to all that gluten-free food that they made that no one likes?
It's only full of sugar anyway. I know, it's so
I mean, they've come up with some pretty impressive stuff, but if you can have gluten again, you go, oh, okay.
I know, God.
Getting like that stretch.
Yeah. So then there's a human whipworm. This is, it actually comes from human feces. You need about 1,000 to 2,000 ova per patient. However, the worst thing about these little buggers is that they cause a lot of problems. So they could actually cause bloody diarrhea and anemia. So not many people use the whipworms. Now, this is where we step in, the HTC. This is a doctor in America, Dr. Sid Baker. He actually discovered these when he went to Africa on an internship and realised that Africans didn't have autoimmune diseases. He realised that they had, like starvation and AIDS and all of that, but there was no autoimmunity. So he went into an investigation to find out why. And then he discovered that they had these grain beetles still on all their grains because they didn't use pesticides. And he was really impressed. So then he started looking at the whole picture and bringing the beetles back into America, because America's wiped out all of their population as well. So then he started harvesting and using them in his clinic. He had his own little, like laboratory out the back, and he cut a beetle open and he'd give it to his autistic kids straight away. And he was finding that their symptoms were actually reversing. So he's got some amazing stories, and you can actually go on some YouTube, and there's one in particular that it goes for about 40 minutes, and it's called Beetle Juice, Beetle Larvae. And it's Dr. Baker being interviewed about autism and kids with autism and how these have actually reversed. And he tells you a story about a child had been non-verbal, and after one dose started making sounds. So, it's pretty impressive.
Yeah. Amazing.
So this is he calls them probiomics. So HTCs were normally found on a food, and as I said, they were totally benign. And the beauty about HTCs is that they do not have any side effects. They are excreted from our system after 10 days, 14 days, because our immune system doesn't recognise them. And when you actually have them inside you, this is what they do. It actually says, your immune system says, oh, this is a foreign body in here, we've got to get rid of these. So it attacks the larvae and not you. So if you've got any food allergies, intolerances, normally if you eat something, you can react to it. But if you have helminths on a regular basis, it will improve because your immune system attacks the larvae of these little beetles, not your actual tissues on your body. And they just work brilliantly. And I've been using them in my clinic for nearly 6 years. I got introduced with them when I went down to Sydney and sat in with Dr. Nancy O'Hara, who's a paediatrician on autism. She did 6 hours of consults in Sydney, 5.5 years ago. And I was lucky enough to be with her, and she kept on talking about helminthic, HTCs, and I had no idea. And at the end, she actually told me all about them and said, oh, you should bring them into Australia. So after 12 months, I was importing them. But the agriculture department was going to stop my import license. So I went over to America last year and got taught by Dr. Sid Baker himself on how to reproduce them in Australia. So this is what we're doing. So they work with allergies and autoimmune conditions. Anybody that I've told you about with autism, heart arrhythmias, gum disease, hemorrhoids. But in my clinic, what I see most beneficial is with ADHD. I'm doing a lot of work with PANs and PANDAS. I get referrals from doctors now that actually say your child needs helminths. I do a lot with anxiety, because as we kept on talking about that, the gut, the brain, so if your gut isn't, in the right microbiomes, you're actually going to cause increased anxiety. So I see a lot of these conditions, and I do a lot of work with Crohn's and ulcerative colitis and seeing really good results. And I'm very sneaky, because if you're really bad ulcerative colitis, you might have to have a drug called Imuran that down-regulates your immune system. But if we just sneak 2 helminths, the larvae, just 2 larvae, in with their treatment, they actually get better quicker. So HTCs can help with autoimmune, certain types of MS, IBS, irritable bowel syndrome, and IBD, which is Crohn's and ulcerative colitis, seasonal allergies. Daniel gets this and he sees a big improvement. And I had a client that just started on them, and within 1 week, she had no sinus, and she's been suffering sinus for years. And she said, I can't believe it, cannot believe it. Food intolerances, I've had clients that have been down to 5 foods and within 6 months are now eating a complete diet again. Particularly psychiatric disorders, and as I said, autism, insomnia, PANs and PANDAS. So it regulates our immune system. So I better go through this fairly quickly because I've been talking a lot. So this is helminthic therapy in IBS. Paris! Sorry. She's been
your delivery man here.
I know, I don't even know what she's barking at. There's nothing to be seen.
Oh, you said that they had an order coming.
Oh, no, not tonight. No, oh, at 8 o'clock. Oh, yeah. Oh, that's right. No, it's not that.
Oh.
So we're actually saying that helminthic therapy acts like a probiotic. Also, with helminths, what they actually do when you ingest them, and that's just, you have them in a 1 ml vial, and depending on the amount of larvae is per vial, but you just ingest them in some oil, and when you ingest them, they actually go down to your small intestine, and Dr. Sid Baker says it's like taking off their coats. But what they actually do straight away, they increase, believe it or not, your short-chain fatty acids. That's what I think is most important. That's why I keep on telling you we need these good short-chain fatty acids to make our probiotics grow. So they actually increase our short-chain fatty acids. They balance our, what we call our pro-inflammatory and anti-inflammatory cytokines. This is like, cytokines are like the armies in our blood, and they should be balanced perfectly. But if we've got inflammation anywhere in the body, the pro-inflammatory cytokines take over and the anti-inflammatory cytokines go down. So what the Helminths do is balance these cytokines out. So increase your good army, which is such as your interleukin-10s. So it's good with asthma and allergies, as I've just said. There's a lot of evidence. And if anybody wants the studies from any of these, I've got them all and I can pass them on to you. This was a big study that was done with autoimmunity with multiple sclerosis in Argentina by doctors, and they accidentally gave helminthic therapy to some clients for their condition, and their symptoms actually reversed. However, they do come back if they stop taking the Helminths. So we know that they modulate the immune system. We talk about autism, and we've seen a huge result with kids on the spectrum. And the beneficial effect of autism, this is an observational study by 541 patients. And in those clients, they all had improvement of GI issues such as diarrhea, bloating, abdominal pain, appetite, yeast overgrowth, and dysbiosis. They had an improvement in their behaviour, improvement in their sleep. They weren't as abusive or aggressive, and their hyperactivity was reduced. It improved their allergy symptoms such as asthma, rhinitis, conjunctivitis, and an improvement of their cognitive functions such as mood stabilisation and obsessive compulsive disorders. So it does a lot. And this is some just testimonies from my clients. Kerry, she was a 37-year-old. She had a 4-year history of autoimmune diseases, allergies, anxiety, and digestive issues. And she was having severe panic attacks, and the doctor put her on some medication. And then somebody suggested that she see me. So we did. We started her on Helminths straight away. And 70% of her symptoms were improved after 1 dose. So that was pretty impressive, and she loves them. She just can't believe how good they are. Mark was a client who's been on them my whole journey. He was one of my original clients, and he's Melbourne-based, and he runs a very, very busy business. He's huge, and he got so bad that he couldn't even go to work. He had to have time off from his professional business. So he started Helminths. He tried everything. He tried every drug. He tried everything. And in 2016, he started Helminths after everything else that he tried. And guess what? Completely helped his anxiety. He's back at work, runs his business. And we did do lifestyle changes as well. As I said, you know, he had to learn to switch off a button, to eat correctly, and he's doing everything. And he's now has no anxiety. And he actually said to me, I'll never come off them because that's how good he feels on them. Kim is another client I've had for years. She's had IBS, rosacea. Her IBS was so severe that she couldn't even travel because she was worried about where the next toilet was. Anyway, since she started on Helminths, her skin's clean and her IBS symptoms have totally dissipated. So she can travel now and she doesn't have to worry anymore. And this is all anxiety, you know, like different people with kids with anxious that wouldn't even go to school, going to psychologists, and since they've been on Helminths, all of their symptoms have actually been reduced. So what I'm saying, you might think these worms are disgusting, but has our war against intestinal worms damaged our immune system and mental health? And my question is, so do you need worms? So a healthy gut contributes to a strong immune system, heart health, brain health, improved mood, healthy sleep, effective digestion, and may help prevent some cancers and autoimmune diseases. So there's 4 steps to heal a leaky gut and get gut happy. remove foods and factors that damage the gut, replace with healing foods, repair with specific supplements, and rebalance with pre and probiotics and or helminthic therapy. I think you need pre, pro and helminthic therapy. But when you're on Helminths, you've got to make sure that your probiotic is the right one. You just can't have any probiotic. You have to have, whether it's a core biotic or Saccharomyces boulardii, they're the only ones you should be taking with helminthic therapy. So my last question is, what does your poo look like? And if it's not a type 4 or 3, you might need Helminths. So that's about it from me.
All righty. Thank you so much, Denise. That was amazing for me to hear that stuff again. And I trust that it was thoroughly enjoyable for our guests as well. I got a bunch of questions, but
Yeah.
we'll take questions from the floor. Where have they all gone? I'll just see if I need to turn their microphones on. Yep. Alrighty. Anyone have a question for Denise or myself? Okay. Well, yeah, there's one that kept coming up. You kept talking about 100 grams of fiber. That sounds impossible.
That's why you need a good prebiotic.
Yeah.
And, you know, I know that you can't get that even if you have a green juice every morning and you're eating all the vegetables during the day. It's really hard to get. And that's why all my clients go home with a prebiotic.
Yeah. And why is it so much more than what it used to be? Is that because we're
our lifestyle, our diet, we've actually wrecked our gut microbiome. And that's what the Helminths also do. They actually increase your short-chain fatty acids. So they work on
more. You're able to improve the microflora of your gut.
Yes.
Yeah.
Yep.
Okay. Yeah.
Yeah.
And you mentioned about the success of hookworms for celiac.
Yeah.
Now people have asked me, because I've been sharing my success with gluten, and they say, were you celiac? I said, well, no, it wasn't. That wasn't the diagnosis, but I'm confident that we can get some results with HTC. What have you found?
Yes, definitely.
Yeah.
Definitely. I've seen a lot of people improve. They've been able to eat. Like one guy, I think I might have mentioned last time I spoke with you, that when he saw me, he was down to 5 foods. And he abused his body. He was 45 when he saw me, and he'd been, cocaine, other drugs, recreational drugs and alcohol. And so his gut was history. So we put him on helminthic therapy, and you're not going to believe it. He's eating everything now, everything. And people have to understand that if you abuse your gut over a lot of years, you actually destroy some particular species that you might never get back again. And Jason Horowitz, who is the guru in probiotics, and he's done thesis and millions of other things, in one of his talks, he just says, and if you actually destroy one particular species, say if it was, Bifidobacter, like LHNA or whatever, that might lead to an autoimmune disease such as rheumatoid arthritis. So you'll never get that strain back again, no matter if you take prebiotics and probiotics. Yeah, and so I believe, after listening to Jason, and I've listened to millions and millions of his talks, that, like this particular client that I was telling you about, I believe that he did destroy so many different species. So that's why he came to me with only 5 foods. But while he's on Helminths, he doesn't have symptoms. He's tried to come off them a few times, and he's symptom-free for about 2 to 3 months. and then he goes back on them. But he actually said to me last time, which was only at the beginning of the year, he went off them and it only lasted 6 weeks, and he said, Denise, I don't care less. I don't care. I'm just staying on Helminths for the rest of my life, because his symptoms are really severe. When he comes off them after a couple of months, he gets everything back again, like chronic fatigue, fibromyalgia, gets a lot. So while he's on them, he's fantastic and you can eat everything.
Sure.
He couldn't eat nitrat. I actually treated him first before he went on Helminths, and we did all the gut work, and he was 90% better, but then that last 10%, I couldn't get better until we started the Helminths on him, and now he's loving it.
Okay. And question about mold. So yeah, you mentioned what that can do for
well, the spores go into your lungs, and then they just start multiplying, and really chronic
mental health,
chronic fatigue.
Moods. Now I'm wondering whether having that healthy gut biome, having the Helminths in there, and improving that ecosystem, whether that gives you, I mean, if you've got mold in your home, you want to get rid of that.
You have to, but you know what?
But
you can't get rid of mold through clove oil. You cannot get rid of mold through bleach. You actually can only get rid of it using a very special vacuum system, and you need a professional to do it. Otherwise, you know what? You best to sell your house, because it's so hard to get rid of.
Well, I might need to talk to you about that, but what I'm asking is whether, whether having that healthier ecosystem is going to afford you more protection, more resilience, so that if there happens to be a bit of mold around that you weren't aware of, obviously, when you find out, you take care of it, but, you're a bit more protected or safe. Is that how it works? Or?
I mean, it's so hard. Mold is such a vicious thing, and if you've been breathing it in for a long time, you'll start getting more and more autoimmune diseases, and it is hard to eliminate.
Yeah, I suppose you just do your best once you uncover these things.
I mean, I've got a lady at the moment that I would love. I'd give anything. She's such a bad mold case, like I'm telling you, mold, and she just doesn't want to know about the Helminths, but I wish that she would do it, because I'm sure she'd see the improvement. She does everything else, but no, she won't do the Helminths. So that's her choice.
Yeah. Everyone has their right to choose.
Yeah, they do.
Okay, well, just check in if anyone else would like to say
if anybody
anything,
wants to know anything, they can either contact you.
Yep, or any feedback. Otherwise, nothing coming forward. Okay, and feel free to give me a bit of feedback as well about whether this was valuable, whether you found it interesting. So just keeping in mind that we're taking a talk that Denise usually does live, and we're bringing it online. So I'd love to know kind of how that goes, what's interesting, where you might have, attention might have drifted, how our attention span's going with being online compared to being together in person. It's a little bit different.
Oh, it's so different.
Yeah, so we'd always love to improve things. But yeah, if this is something that you're interested in exploring further, there'll be a little survey, and I'll also drop my email in the chat box now in case that survey falls through. So it's just dan@sovereignmedicine.com, and we can explore the best way that I can serve you in healing your gut and helping you take the next steps forward with your life. So we can, I spelt my own name wrong. If you're interested, then we can jump on a call in the next couple of days, and just explore what's going on for you and put together a plan that's specific for you, for your needs, and what's going to be the best way forward. Yeah, and if you're interested in the recording from this session, I want to share it with some friends.
Or if anybody wants any studies,
And
research
if you want the
studies.
slides as well,
Yeah.
I would like to know anything more from Denise's end. I suppose still get in touch with me, and if I can always connect you with Denise if that's what needs to happen.
Fair enough.
Alrighty, thank you everyone for a wonderful for joining us on this on this wonderful webinar. Thank you, Denise.
That's all right. Pleasure. My
For
pleasure.
sharing your passion and your expertise, and for healing this collective gut biome so that we can be a more cultured folk, more healthy, wise, loving, powerful, be our natural selves. So
Exactly. Well, thank you for having me. It was wonderful.
pleasure. All
And
right.
if anybody's got any questions later, if they want to shoot me an email if they're in doubt of anything, that's fine.
Oh, good.
Yep. All
right.
good.
Have a beautiful
Thanks,
night.
Daniel.
Till next
Yep.
time. Ciao for now.
Okay. Bye. Bye.